Due to the chronic nature of Crohn's disease, your child will most likely have ongoing imaging and tests to examine disease progression. Or if and when a flare-up should occur, they might have to undergo further procedures or interventions to help with management of symptoms. We will discuss a couple of those so you can have the right tools and techniques in order to provide preparation to your child prior to the test or procedure occurring. Something that your child might have to undergo frequently would be some type of imaging, whether a CT scan or an MRI scan. I will discuss with you what a CT scan is and also an MRI scan and the ways that you can practice with your child so that they can be most prepared for what their most important job would be, which is lying still during the scan. You can start by finding a picture online of a CT scanner or an MRI scanner. You can simply Google it. It's important that the picture includes the scanner itself in addition to the table that they will be laying on. You can explain to your child how the camera is the circular piece here, and then that they will be laying on the table. And the table will move in and out of the circle, but the camera itself will not touch them or hurt them. Now you can practice with your child lying still because this is what allows for the pictures to turn out clear so that the doctors are able to read it thoroughly. Now you can practice with your child by having them lie still on their back with their arms at their side and their legs straight. You can use a timer and time them lying still for 30 seconds. Once they do this successfully, increase it to 45 seconds, a minute 30, etc. For a CT scan, you shouldn't have to practice longer than 3 minutes, but the more practice, the better, because if they should have to undergo an MRI scan, this could be much longer, 45 minutes or perhaps longer than that. And the difference between a CT scan and an MRI scan is that the MRI scanner makes a lot of loud sounds. And this is also something that you can Google the sounds of so that your child can become more familiar with what they might sound like. Now, if your child is having intense stomach pain and is unable to eat because of this, they might have an NG or NJ tube placed. A nasal gastric tube is referred to as an NG tube, and this goes from the nose down to the stomach, whereas a nasojejunal tube, the NJ tube, goes from the nose past the stomach and into the intestines. Now, this would allow for bowel rest and then nutrition, like I said, if your child is not eating or has pain from eating. You can explain to your child that an NG tube or NJ tube is a bendy, hollow tube that goes from the nose, have to find it, from the nose down through the throat and into the stomach or beyond the stomach. And this tube works just like a straw in that it helps carry liquids to the place that needs to go, and in this case, the belly. So the medicine goes right in through the ends or the liquid, whatever is going in there, and then it gets passed through and carried either pushed through a syringe or with a pump, and it goes to their stomachs, and it carries the medicine and the nutrition that they need while giving their body and their bowels the rest. To provide an opportunity for your son or daughter to feel an increase in understanding and normalization about an NG or NJ tube, you can work with them to create a tube with pipe cleaners and a stuffed animal or even a cloth doll. Have your son or daughter work on this project with you so that you can have a hands-on experience together, but so that there's also the ongoing conversation and teaching opportunity. So using a stuffed animal or a doll that has a soft nose, you can make a small slit with scissors, and then you can insert the pipe cleaner into that slit. And then to make the tube longer and extend it, you can twist together pipe cleaners so that it's longer to represent the length of the tube that is on the outside. Now, to assure that the tube stays in place, you can simply use a piece of tape to adhere it to the face so that it stays right there and does not move. And then you can work with your child to make the connection, the correlation between the tube that is on the stuffed animal and then the one that they have to get.